Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, for the diagnosis of duodenal ulcers. Duodenal ulcers are best diagnosed by GI endoscopy because with the help of GI endoscopy, we can visualize the duodenal ulcers. So, duodenal ulcers are best diagnosed by upper gastrointestinal endoscopy. Then, we can also do a double contrast barium studies can also be done for the duodenal ulcer. Like we can do a double contrast barium studies, the double contrast barium studies can be done for a duodenal ulcer. Like we can do a double contrast barium meal can be done, or you can also do a double contrast hepatic hypotonic duodenography is also done. A double contrast hypotonic duodenography can be done. Double contrast barium studies like double contrast barium meal and double contrast hypotonic duodenography are also done, can be done for a patient with duodenal ulcers. Right. And in some patients with there is fiber endoscopy is also useful in certain patients. See, in certain patients, fiber endoscopy is useful in visualizing the post-bulbar ulcers or duodenal ulcers or stromal ulcers. Actually, these ulcers can be missed by the in the X-ray. So these ulcers can be visualized with the help of a fiber endoscopy. Okay.
thank you and thank you for watching.